Hi everyone, my name is Tina Maiozzi, and today I'm going to talk about a scenario where a patient, Mr. Jones, who is a 40-year-old African-American male, is being seen for his long-standing history of uncontrolled hypertension, and how our blood pressure impacts our cardiovascular and our lymphatic systems. So I met with Mr. Jones today, and he has a long-standing history of hypertension. But not only that, he has a significant family medical history, along with his own significant cardiovascular risks of disease. He has a direct family history where both parents passed from hypertension or complications of hypertension. One of those parents with type 2 diabetes, which is another vascular disease. He was a former smoker. He drinks several beers a day. He doesn't pay attention to his intake of fat, sodium, or carbs, and he does not exercise regularly. He's reported a weight gain of 20 pounds in the past year with reports of shortness of breath with minimal activity, and he has a high-stress job as a police officer in a high-crime neighborhood. So definitely a lot of opportunity here for a great deal of patient education. And since he is already experiencing complications of the disease, I'm going to make sure we take some time to write down some information as we talk, as it can be overwhelming to hear all of it at once. I'm going to start by explaining in layman's terms the patho behind primary, secondary, and complicated hypertension. First of all, hypertension is the prolonged elevation of blood pressure. It's super prevalent, but what causes it? Risk factors, age, race, family history, obesity, level of inactivity, smoking, diet, oral intake of high amounts of sodium or low amounts of other elements such as potassium, calcium, and magnesium. And also alcohol consumption contributes, as well as stress factors. Primary hypertension or essential hypertension has a gradual onset. It can take years to develop, and there is no real identifiable cause. This one is also called the silent killer because often obvious symptoms are not present, and it can be well advanced before signs and symptoms like headache, dizziness become a problem. Secondary hypertension appears more suddenly. It's due to a variety of other diseases that cause the high blood pressure, such as renal disease or even sleep apnea. So you have a normal blood pressure, happen to get another condition that then causes the blood pressure to rise. Complicated blood pressure is what means when we talk about clinical outcomes that result from the persistent or constant elevation of blood pressure. Blood pressure can become so elevated that causes organ damage. We refer to that as malignant hypertension, and then that just means high and uncontrolled. It is the constant highness that causes the damage that leads to cardiovascular disease such as heart failure or heart attack and stroke. Based on what I know about Mr. Jones, the most significant information related to hypertension in his history is two things: his direct family history and his lifestyle risk factors. His mom had diabetes when she passed from complications of hypertension. People are 2 to 4 times more likely to die of heart disease when they have diabetes. This is because diabetes is a disease that also affects the blood vessels in our body. Over time, uncontrolled sugar levels lead to thick and hard vessel walls, resulting in coronary artery disease or a heart attack, or cerebral artery disease or a stroke, because the blood in our vessels cannot optimally travel to where it needs to go. So along with his direct family history, he has also more secured risk factors or non-modifiable risk factors, meaning he cannot change these. They are his family history, age, and race. African Americans are among the highest population, along with Latinos, Native Americans, and Pacific Islanders for hypertension. Mr. Jones has quite a bit of modifiable lifestyle risk factors that we can talk about today. He already quit smoking, and that is a huge defeat. Congratulations, Mr. Jones. Your body thanks you. Smoking constricts the blood vessels that can lead to heart disease. His weight gain and shortness of breath with minimal activity hopefully will improve as we improve these other lifestyle factors, as the blood pressure lowers and fluid is removed. So I believe chipping away at some of the modifiable contributors will start first. So diet. Diet is, I believe, number one after quitting smoking. I would discuss with Mr. Jones some options of some good food choices to help educate him on the roles of sodium, fat, and carb. intake. Acknowledging sodium intake can be shocking at first. I usually start with saying to avoid canned foods, and that follow that with some information that usually what you buy canned, you can also buy frozen. But don't get tricked by that frozen option, because prepared meals such as TV dinners, pre-made fast foods also have a higher sodium content. And for processed foods, I recommend trying to stick to fresh is best. A trick I use for this at the grocery store is shop the perimeter. Most processed foods are located on the inside aisles because they have to have a longer shelf life, and what that necessitates the different sodium ingredients to keep them there longer. Fats and carbs contribute to hypertension because they contribute to obesity. Obesity can lead to insulin resistance or diabetes. High fat foods and also leads to heart disease. Limiting sodium or salt consumption to 2,300 milligrams a day, which is about less than a teaspoon, is a measurable goal. So what can you eat, Mr. Jones? Mr. Jones, you can eat whole grains, fish, poultry, beans, seeds, nuts, minimizing sweet and sugary beverages like pop, and even our electrolyte beverages usually contain a lot of sugar. Limiting salt, the extra salt we put on food, and red meats. Red meats are high in fat. So you can focus on non-red meats, chicken, fish. And if you are going to do dairy, stick to low-fat dairy products, as they're regular dairy can be high in fat. Next, I would recommend he increases physical activity to a goal of 30 minutes a day to help control his blood pressure. This is more than he's probably used to at this time, so a gradual start to this goal is recommended. He could start with walking every day. This will increase his activity tolerance as well as help alleviate some extra stress in his life from his job. I'm going to ask that he limit his alcohol consumption and minimize stress at the workplace the best he can. This will also help Mr. Jones lower his blood pressure. As Mr. Jones begins making healthier choices with his diet, he will increasing his physical activity, limiting his alcohol consumption. He will begin to see and feel improvements with his weight, his blood pressure, and his minimal shortness of breath with stairs. The most important information here is that Mr. Jones, who was already genetically predisposed for hypertension and diabetes, currently has a diagnosis of primary hypertension. What's important is that he's acknowledged his symptoms of disease, and he is being seen right now to help manage them. So that's really important. Since Mr. Jones is predisposed for hypertension and diabetes, I will choose diabetes as one of the effects of sustained complicated primary hypertension. High blood pressure leads to many vascular complications, right? So someone with diabetes is at risk for hypertension, and therefore someone with hypertension is also a risk for diabetes, because both these conditions affect the vasculature of our body. Oftentimes they coexist. And this is because hypertension and diabetes share a lot of the same bodily processes that link both conditions, such as inflammation and disease and thickening of the blood vessels. They also share risk factors such as obesity, sedentary lifestyle, unhealthy diet, stress, and smoking. People with high blood pressure usually have insulin resistance from these shared risk factors, and therefore have an increased risk of developing diabetes. So while hypertension doesn't directly cause diabetes, there is a pathological effect due to the shared risk factors and bodily processes that are linked. Uncontrolled high blood pressure means your heart and blood vessels have to work harder. And over time, this overworking damages those vessel walls. Damaged vessels can also have fats and cholesterols that adhere to them, lessening the blood flow to vital organs such as the kidney. Uncontrolled blood sugar levels from diabetes also damages vessels over time. This damage in the kidney, for example, can cause the kidney damage and the blood pressure to rise. Because diabetes is also a disease of the vasculature like hypertension, both share similar manifestations, which we call atherosclerosis, which is the plaques or the fats on the vessel walls, high lipids or dyslipidemia, which is high cholesterol or fat levels, obesity, and that vascular inflammation that causes the changes inside the vessel walls. So recommendations of self-care to avoid diabetes along with his hypertension include lowering that sodium in his diet, limiting his alcohol intake, adequate exercise, weight management, limiting stress, and tobacco products. Frequent monitoring of blood pressure levels at home with documentation is recommended to provide at these doctor visits. It's also a very good visual aid for the physician, for the patient to have good blood pressure control. Thank you.